Hello, guys, and welcome to this video about surgical needles. So, in this video, I will talk about first about simple definition to surgical needles. Then, I'm going to talk about the needle parts. So, the needle end first, then the needle body, and finally the needle tip. So, surgical needles used to carry the suture material into the tissue, and it should be strong so it does not break during suturing, and sharp so it penetrates tissues easily, and slim so it causes a smaller hole in the tissue so it causes minimal tissue trauma, and sterile so it does not cause infection to the tissue. And the needle components are the needle end, needle body, and needle tip. So starting here with the needle end. So it is the portion where the suture material is attached to. And it is either swage, eyeless needles, and those the suture materials in these needles connect to the inside of the needle. And there is the eyed needles where suture material connected to the eye of the needle. So in swage needles, the eyeless needles, only one strand of the suture material is attached to the needle, and it's meant for single use only because you can't reload the suture again into the needle because it does not have an eye, it's eyeless needle, and the suture uh, is connected uh, directly, and you can't reload it again. So it is for single use only, the suede or the eyeless needles, while the other type, the eyed needle, where the needle end have a, a hole that you can connect the suture to. Uh, so in this needle, there is two strands of the material is carried, one going into the needle and the other one is outgoing from the eye of the needle. And the needle size is bigger compared to the eyeless needles, and this produce bigger holes in the tissue means more tissue trauma and more infection possibility. But those are cost effective because you can reuse the eyed needles while the swage needles you can't reuse them. And the swage needles they have less infection possibility because they are single use, while the eyed needles have more infection possibility because those are reused and infection might be more possible using these needles. So now, for the needle body, and the needle body is either curved or straight, and there is degrees to each of those. So straight needles, as shown in this table, so this table describe the needle body and the uses of each one. So the straight needles are used by hand for skin closure, but those are rarely used. And the half curved needles, those used for laparoscopic surgery. And there is the curved needles, which have different curvatures. We have the quarter circle, the one divided by four circle, which used for ophthalmic surgery and microsurgery. And we have the 3/8 of the circle, and this is the most commonly used type of curve, and it is used for superficial and large wounds. And we have the the 5/8 of the circle, and this used for deep wounds and used for the urogenital tract, the pelvis, and the oral cavity. And we have the half circle uh, curve, and this is used for GI tract, the peritoneum, and the respiratory tract. So, and I have this drawing here. So this is the straight needle, which is used by hand and it is rarely used. And this is here the half curved needle. This is used for laparoscopic surgery. And we have this the curved needle, which have different curves, and each curve have different uses to it. Now for the needle tip, which is the point that penetrates the tissue, and it is classified according to its cross section. So we have the round bodied tapered, and we have the round bodied blunt. So the round bodied meaning it is a circular cross section of the needle tip, and tapered means it penetrates or it is tapered uh, as the word means, and it is used for the muscle, the fascia, the peritoneum, and the mucosa. And we have the round bodied, meaning the cross section is circular, and it has a blunt point. And this used for ocular muscles and for friable tissues also. And we have the cutting needles. Those have triangular cross section, and the triangle is pointing inward. And those used for dense tissues like skin and tendons. And we have the reverse cutting, where the cross section of the needle is also a triangular shape, but the triangle this time is pointing outward, and it is used for skin. And we have the side cutting needle, and those have a trapezoidal shape or trapezoidal cross section, and those used for the eye surgery. And this drawing here shows the symbols that's used for each one. So we have the round bodied needle, tapered point. Those are either either expressed by this symbol, which is a circle and a dot in the middle of the circle, or the in the center of the circle, or expressed as a circle, which is dyed in black. While the round-bodied needle, which have a blunt point, is expressed by a hollow circle. The cutting the cutting uh, tip is expressed by a triangle, which is the cross section, the shape of the cross section, and the triangle is pointing upward. And the reverse cutting needle is expressed by a triangle, and it is pointing downward, and the side cutting needle is expressed by trapezoid as shown right here. And that's it for this lecture. Thank you guys for watching. Please like this video, subscribe, and there is another lecture in this playlist, which is like a video uh, like a video clip of me unboxing different types of sutures and explain each type and what is the characteristic of each one. Yeah, so you might want to check this out. Yeah, and thank you guys, and bye.